Questions being asked, how can we reconcile modern medical procedures with cultural practices like male circumcision? More and more young men dying in botched procedures, and some are even mutilated. We understand at the moment 23 young men have died in Mpumalanga initiation schools. I need to note it is not just one school, it is around the province. A huge pleasure to welcome back to the show Dr. Ntlotleng Mabena, who works for the Centre of HIV and AIDS Prevention, and male circumcision is one of her specialities. Doctor, good morning to you. Always a pleasure to have you on the show.
Good morning, Gareth.
How, in this day and age, regardless of culture, are we seeing 23 young men dying?
Gareth, I think I need to state at this point that I speak as a medical profession, as a healthcare provider. What we do circumcisions based on the health benefits that exist from the procedure. I'm sure you've seen research talking about circumcision reducing the risk of HIV acquisition by about 60%, etc., etc. Having said that, I do realize that in context within South Africa, we do have initiation schools which have been running for years on end, even way before this circumcision, this medical male circumcision program came about from the National Department of Health. So the question is, how do we as healthcare providers now engage with traditional initiation leaders to be able to offer a service that will not lead to the loss of lives or injuries to the initiates which are attending those schools?
I imagine as a medical professional, as you've stated, you are speaking in that capacity at the moment, you would have seen some of these incidents where there is mutilation, there is severe injury to the males taking part in this. What is going wrong in Mpumalanga that we're seeing such a high death rate? What is not being discussed? What is not being taught? What is not being done as a medical professional?
The biggest problems that cause problems when we see these procedures that eventually end up in loss of life or even mutilated genitals would be the biggest causes of death are infection, number one. So infection coming in through the wound, which is not properly looked after. Eventually the infection goes through the system, causing sepsis and eventually leading in the loss of life. The other biggest complication would be bleeding, where the traditional providers don't necessarily know or have the skills of how to stop the bleeding after they've performed the traditional circumcision.
Would you agree that talk of male circumcision and the practice, which needs to become more safe, needs to come from the highest powers in South Africa? Would that be a fair statement of mine?
That is absolutely
I understand your position, and I ask it with due respect. How then do you think we're going to get on top of this if the Mpumalanga MEC for Health clearly states on our program she can't talk about it because she's a woman? How do we fix this then?
We need to get to a point where we all remember that medical male circumcision or circumcision for men, although to us is a health issue, it is also a traditional issue. When it leads to a point where people lose lives, it has to be spoken with affirmation from the highest level of authority. This is where we would need our Department of Health to come and engage directly with the DDG of traditional leaders, where they would sit down around the table and look forward, see what needs to be done, where collaboration needs to happen, so that we could either train these traditional initiation schools to provide a better service and of a better quality, so that we don't end up with complications and death.
I need an answer in 30 seconds, with all due respect, Doctor. No. Are you at all engaging with the Council of Traditional Leaders? They say they're going to continue with the initiation schools this season. Are you talking to them? In
the areas that we are working in, we do have collaboration with some initiation schools where they actually bring the initiates to our center for us to circumcise them and then take them back to the mountains.
To continue with the tradition and the culture.
To continue with the initiation process.
Doctor, a huge pleasure in having you in this morning. Thank you very much indeed. Dr. Ntlotleng Mabena from the Centre of HIV and AIDS Prevention joining us on the show this morning.
News that moves. eNCA.com.